Hi, my name is Niamh Healy, and I wanted to go through the anatomy of a pregnant woman and her baby using these three charts to help you understand where all the various parts of a woman's body are and where her baby lies in relation to those parts. The three charts I have here show a woman side on with an internal view so that we can see inside. And the first chart shows the body of a woman who is not pregnant. The next chart shows a woman who is about 36 weeks pregnant, so close to full term, but not yet full term. And then the last chart shows a woman who is full term, close to giving birth, and her baby is well descended down into the pelvis. Let's have a look in closer detail at the anatomy. So very obviously, we have her baby here. I'm not going to put a label on the baby. And then we have the amniotic fluid around the baby, and there's about 1 litre of amniotic fluid by full term. Here's the baby's umbilical cord, providing life support for the baby during pregnancy. Then the uterus is this big muscular bag all the way around the baby, starting at the cervix, going up and around and all around. And we'll compare it to the pre-pregnant size later when we're looking at the differences between the three charts. So we'll label this the uterus. Then we have the placenta, and the placenta lies on the inside wall, is attached to the inside wall of the uterus, and it's generally to the top and to the back, but it can be in other positions too. Then in terms of the path that the baby takes out as he or she is being born, here we have the cervix, which is also called the neck of the womb. Then we have the vagina, which is also called the birth canal. And back here then we have the end of the digestive system, and we have the rectum, or also called the back passage, and then the anus at the very exit of the digestive system. Then we have the perineum, which is this muscular area between the outlet of the vagina and the anus. To the front, we have the bladder for the collection of urine coming from the kidneys, and then the urethra for the passage of urine. And I'll show you these three labels which label parts of the pelvis, important parts of the pelvis, and then I'll show you on my own body and then on a pelvic model. We have the pubic bone here at the very front of the pelvis. We have the sacral promontory, which is a rounded out part at the back of the pelvis, and then the coccyx, or the tailbone, right at the very end of the spine. So the pubic bone would be here at the very front of the pelvis. The sacral promontory is lower than the small of the back, and as the area of the spine and the pelvis rounds outwards, that's where the sacral promontory is, and then the coccyx is further down right at the end. Showing you on the pelvic model, pubic bone here to the front, sacral promontory at the back, and the coccyx at the very end. And the coccyx is free to move if a woman is in an upright, forward, or open position. So a position like kneeling and leaning over the back of the bed, or kneeling and leaning over a birth ball, any of those sorts of positions, the coccyx is free to move, and it makes it easier for the baby to make his or her way out as they're being born, compared to a position where a woman is lying tilted backwards, propped up, where her sacrum and her coccyx aren't as free to move. Let's have a look at the changes in the body then between a woman not being pregnant and being full term. Here's the uterus. If a woman isn't pregnant, it's about the size of a pear, and it's low down in the pelvis, compared to full term, where it is now about 1.2 kilos and is forming this big muscular bag all the way around the baby, the amniotic fluid and the placenta. A woman's internal organs aren't attached to anything in particular, and they just get pushed out of the way to make room for the growing baby and the growing uterus. A woman's rib cage may have to flare outwards to accommodate her growing baby, but also to allow more room for her lungs to inflate outwards rather than downwards, as the diaphragm is now pushed upwards by the growing baby. A woman is laying down more breast tissue over the course of her pregnancy in preparation for breastfeeding. And comparing the differences between late pregnancy and full term, 41, 42, 40 weeks or so, the baby's head has descended into the pelvis and there's less room for the bladder. So from here to here, there's less room for the bladder, but there's a little bit of a trade-off because now pressure has eased a little bit on the diaphragm, and sometimes that gives women relief from reflux or heartburn, which can be caused by the weakened valve from the stomach. The biggest change, though, that we're interested in terms of whether a woman is ready to give birth or whether her baby is ready to be born, is the change in the cervix. Before a woman is ready to give birth, the cervix is quite long and quite firm and pointing slightly towards the back. And when I say firm, it's like the cartilage in your nose, fairly firm. Now, in this picture, this woman is closer to being ready to give birth, and her cervix is softer and shorter and has come around slightly to the front, and perhaps even some of this plug of mucus has come away in the form of the show. And again, when I say softer, this is like the consistency of lips. So these are the important changes that sometimes caregivers are looking to assess to see if a woman is ready to give birth. And I think we've covered all the important points, and I hope that has helped.